Good afternoon, everyone, or if our friends from Hawaii are on, good morning. It is just 3 o'clock here Eastern Time, and we will get started in just a few moments. Our friends at the Office of Child Care were planning to join this morning and do a welcome message for us, but I'm not seeing audio connected yet for Dr. Ellen Wheatley this afternoon. So we're just going to give it a couple minutes and see if we can get the audio figured out at the Office of Child Care. Thank you.
You're connected. Okay.
Oh, hi there.
Hey,
Is that
how are you doing?
Linda and Ellen? Hi.
Yes, and Anton
Perfect.
is here to help us as well.
Yes, thank you, Ellen. All right, we were waiting for you guys to join us and get the audio going, so if it's okay, I'm going to go ahead and kick us off.
Excellent.
Thank you. So again, good afternoon, everyone. This is Leanne Bryan from the National Center on Subsidy Innovation and Accountability, and I'm very excited to start our newest webinar series within Program Integrity. Today is our first webinar. You can look for these quarterly as we move forward in the fiscal year. But today's webinar is all about data mining, data sharing, and data analytics. So a little bit about the call logistics before we get started. We will take breaks throughout the session this afternoon for questions and answers, and we definitely encourage participation. If at any time you should have a question or just kind of want to hold your thought, feel free to type questions into the question box in the GoToWebinar dashboard, and we'll monitor that question panel and get questions answered as soon as we can or at appropriate stops throughout the session. If you are using your phone to call in as opposed to your computer speakers, you do need to enter your audio PIN number in order to unmute your line and be heard to participate in this discussion or ask questions. And if you have not entered your audio PIN yet, please go ahead and do that again so that you can unmute your line and be able to interact with us this afternoon. To keep our audio as clear and crisp as possible as we're presenting, we will be muting all of the attendees. But again, if you'd like to ask a question during a break, please raise your hand using the GoToWebinar dashboard. Or again, you can type questions into the question box and we'll monitor that, try to get it out to everyone if appropriate. Last point on this slide, if you should have any issues with GoToWebinar, you can email Katie Watts at kwatts@wrma.com. And one other quick note, we do have these slides in the handout box. Everyone who was registered as of early this morning did get an email from me with the slide deck attached. But if you happen to be a late register or for some reason didn't get that email, feel free to download the slides in that handout box. All right, so introductions for this afternoon. That's me on the left, Leanne Bryan, Program Integrity Manager here at the National Center on Subsidy Innovation and Accountability. And with me this afternoon is Janae Broadway. Janae comes to us from Louisiana's Department of Education. She was the fraud manager in Louisiana and NICSIA's, or the Subsidy Center's, new program integrity specialist. So she is our program integrity guru here at the Subsidy Center, and we're very happy to have her with us. I see a lot of familiar names as I'm looking down through the attendee list, and I'm hoping that my name and Janae's name as well will become more and more familiar to each of you as these webinars continue. And now I'm going to turn it over to Dr. Ellen Wheatley from the Office of Child Care for another welcome message.
Hello, everyone, and thanks so much for joining us. It's really great that you're taking the time to really learn more about data, about internal controls in the National Program Integrity Webinar Series. And the reason I'm so excited about data is, as a state administrator for 8 years, data was often what saved our program not only money, but a lot of difficult conversations as well. So let me give you a couple of examples. If you don't have data and you say to your secretary or commissioner or your IT person, we need to have some controls to prevent school-age providers from charging for the whole day of care during school days, you're really going to get back in line and stay with everybody else who's waiting. However, if you pull the data and you can show the thousands or tens of thousands of dollars of fraud that can be prevented before it happens, and say all you need to do is prevent those providers from charging the whole day. Put a cap on the half day, ta-da. Another example is license-exempt families. If you have a large population of refugee families and they're not licensed, but they're taking care of the children from their small group, you might start out with 2 or 3 little children being with them, and then pull some data and find out they're up to 12, which of course in most states would be illegal. How do we know that? Pulling the data. So I highly recommend learning all you can about data mining, learning all you can about all of the internal controls that are possible, and even getting into the data analytics and agreements. All of that will not only serve you well for preventing fraud, but will serve you well for all the messages that you need to get out to the general public, out to the federal funders, out to your commissioner and other state programs. So I hope that you find this very helpful, and I look forward to the next one, and I will see you then. So I'll turn it back over to you, Leanne.
Thank you, Ellen. I'm fascinated, I guess, to hear some of your comments, because we will be talking about just those things throughout the webinar. And I know you didn't see our speaker notes, so I'm very happy to hear that we're all on the same page with this one. All right, so here is our agenda for this afternoon, or for our 90 minutes together. To get us started, I'm going to discuss the connection between those program internal controls, data mining, data sharing, and data analytics. Then Janae is going to dig into each of those data topics a little bit deeper, and together we'll tackle the challenges as well as the benefits of each of these strategies. And of course, if we're talking about client data, we've got to take a few minutes to discuss confidentiality and keeping the data secure, as well as written agreements. So when it comes to data matches or data sharing across programs, there's likely some written agreements in place. We'll also pause many times throughout the webinar to allow an opportunity for our states, all of our participants, to discuss and share strategies with each of these techniques, and the key points that they might be doing in their state and they would like to share. All right, so let's dig in. We're going to start with internal controls, the correlation with data mining, data sharing, and data analytics. So as you all are very well aware, CCDF lead agencies are required to have internal controls in place to ensure program integrity and accountability, but at the same time, maintain continuity of services for children and families that we're serving. And those measures should include detecting and deterring fraud, program violations, and potential errors that you may see in your program. Internal controls are generally processes that include screening and checking of both eligibility determinations and payment decisions, as well as identifying areas of any potential risk. So thinking about where may errors occur within your program, or where are errors occurring, and how can we improve processes to prevent future errors. So essential parts of internal controls for our discussion today are going to be data mining, data sharing, and data analytics. So from our perspective, effective internal controls should include data systems that provide at least 3 elements. So we're looking at prevention, detection, and prediction. Preventative elements are established to stop fraud, stop program violations and errors before they occur. And when I think of the preventative element, for whatever reason, geomapping always pops into my mind. So this is a good example of data sharing. So right at the start, there are a lot of programs out there that as soon as an eligibility worker is entering in a client address, or maybe somebody on the provider side is entering in a new provider address, there is an automatic run or an automatic connection with software that's matching that client address to something like the census and ensuring that that address is correct right from the start of, requesting benefits. Detective elements are established to identify fraud, program violations, or potential errors after the occurrence. So for this one, we think mostly about data mining and all of those red flag reports that we know you're running every day or monthly within your programs. The predictive elements are established to identify errors which are error prone, maybe prone to fraud and or program violation risks. And for this one, we think more about the data analytics and really diving into data mining and taking the next step. Data mining, sharing, and analytics are all efficient and effective tools for each of these 3 elements of internal controls: prevention, detection, and prediction. Before turning over to Janae, I just want to point out to everybody that these data terms that we're using and the definitions of each can really vary greatly. No matter whether we're doing a general search on data analytics or if we're digging into program office websites, the definition or how they are described really can vary greatly. So just hoping that one of the purposes of today's webinar is to try to get us on the same page or maybe on the same chapter when we talk about data mining and data analytics. So with that, I'm going to go ahead and turn it over to Janae to dig into data mining.
Awesome. Thanks, Leanne. So let's jump right into data mining, right? What is data mining? On the back end, data mining uses algorithms or programming logic to review and prepare information across large data sets. Now, this review and preparation can sometimes be called churning. And when churning through these large data sets, the data mining is looking for patterns. Now, these patterns are usually set by an IT or systems person through some type of programming logic. These programming logic principles are looking for quantifiable results related to processing, discrepancies, and even consistencies. From data mining, the lead agency can produce, as Leanne stated and most of you know, what are called red flag reports and other types of reports depending on the lead agency's needs. Now, red flag reports can assist the lead agency by notifying them of these discrepancies as part of their internal control processes. Now, what you'll see there is a list of possible discrepancies or red flag reports. For the most part, all of these could result into an improper payment, but let's just go through a few of them. With a potential improper payment set as a red flag report, it could filter information to an exceptions report. And that exception report could notify the lead agency of incorrect payment rate for a provider type or level of care. There's the processing delays. At application or redetermination, the application was not processed in a timely manner as set forth by the lead agency. We also have here the graduated phase out, benefits not being applied appropriately. The lead agency has it in their policy and procedure that the family should receive an additional 12 months of benefits after going over that initial eligibility threshold, but underneath that 85%. But on the floor with the eligibility workers or wherever the eligibility worker staff is located, that action is not actually happening. So a notification could come to the administrators or program managers or people in leadership to let them know that, hey, this action is not actually being performed on the floor by the eligibility staff. In addition, there's the continuity of care issues, not receiving the full 12 months or at the state's discretion, the family benefits terminated prior to the 12 months, but that 3-month job surge was not provided to that family. So that's another type of red flag report that could be included in your data mining. And of course, in most cases with large data sets, certain things can be missed by the human eye. So having that automation going provides a better internal control and leads to this being the detective element of internal control. But overall, the red flag and the exception reports are crucial to the internal controls because they give the administrators, managers, and QC staff and supervisors a first-hand look at the processes and or policies that are implemented and if they're implemented correctly or should they be changed, should necessary changes happen to ensure that these processes are going accordingly to the expectations of the agency. And as we move past that, we'll talk about that communication phase, right? So how is this information being communicated in data mining? It can come from integrated or non-integrated systems. Those integrated systems, for the most part, are talking to each other. In some cases, that may be the time and attendance system and the payment system. And it provides those exception reports that we spoke of earlier. Then you have those non-integrated systems. In most cases, and this is very popular, the eligibility and the licensing systems are separate. So those systems don't really communicate, they stand alone. So the information would actually go to what is called a data warehouse to produce those data mining reports and red flags and show you things like an address match. The client and the provider share the same address. So the communication and data usage can be the key function to data mining and assist in those internal controls. So let's have a look at what you guys are doing as lead agencies and states when it comes to data mining. As you see, we have an estimated 70% of CCDF lead agencies utilizing red flag reports to identify potential errors. So let's talk about that, and I'll turn it over to Leanne now. Leanne?
Thanks, Janae. Yeah, so as we were doing our research, we did come up with about 70% of lead agencies utilizing types of data mining. And just as a FYI, most of our information came either from the 2016-18 state plans or the draft, not yet approved, 2019-20 state plans. So get your fingers ready. We're going to do a little exercise here. I'm going to launch a poll just to get an idea of our attendees on the phone. About, I would say 75% of you are from states that are on the call today. So if you could just respond here quickly and let us know if your state is currently using any type of data mining reports. Give you all just a second. Looks like about almost 50% have voted, so we'll give it just another few seconds. All right, thank you. Oh, I see a couple more trickling in. All right, I'm going to go ahead and close it and share the results so you all can see. So the vast majority, 79%, are doing some type of data mining within their state. So that aligns pretty closely to the data that we were able to pull. But then we have some that are unsure. So maybe you're newer to program integrity or newer to your program office and certainly can look into these things a little bit more following the webinar. So now the opportunity, hopefully, that everyone's looking forward to is hearing a little bit from one another about what you all are doing in this particular area. So hopefully we have at least a couple states out there that would like to share what they're currently experiencing or their current strategies related to data mining. You know, what reports might they be running and have found really beneficial, or anything else you'd like to share with your peers. If you would like to share, if you could please raise your hand and we'll start those discussions.
Hello, this is Louisiana. Can you guys hear?
Oh, hey Melinda, good to hear you.
Great, great. We were cheering in the introduction. Louisiana.
Oh, I bet you were. Should I be apologizing?
Yeah. No, we're happy. We're real happy for her. We use a lot of different reports, Leanne. We run a lot of reports that help us. We use data all throughout our program. Some of the reports that we run, an out-of-conformity report, it helps us to identify when analysts have delays in processing. And that is important because we're serving families and we want to serve them as timely as possible. We have reports that match provider addresses and participant addresses, expired service authorizations outside of hours. Sometimes providers are open or they have children outside of normal business hours or the licensed hours. And we do know that sometimes parents pick up children late, but our report captures those that are extensive or on Saturdays or holidays, because we don't want to pay for times when children aren't in care. Excessive back scanning, when a family back scans a large number of times, sometimes there's a percentage. We can pull a report that'll give us a percentage of back scanning for each child care provider, and we look at those those providers with high number of scans. We provide TNTA. We use our data first to we usually visit and we try to determine if it's an error by them not knowing. So we provide TNTA through our provider help desk, and we also monitor to make sure that we're not paying out for times we recoup money when necessary, when children aren't in care. Previous checking it out, outstanding payables reports, and a number of other reports. We review cases. We have a very stringent case review process, and we collect data from samplings of cases continually to ensure that errors that are noted, that we address them with technical assistance, with revision of policy, and anything else that we can do to make sure that we stay on top of and we have a secure program.
Thank you, Melinda. Lots of good things happening in Louisiana. Does anyone have any questions or any kind of follow-up comments? Would anyone else like to share maybe their, top 2 or top 3 red flag reports that they use almost daily or maybe weekly in order to identify potential improper payments or just data collection methods, something that they use frequently in their program? You can type into the question box or you can raise your hand. Oh, thank you. I see Paul from California. Go ahead, Paul. Thank you.
Hello. I'm going to speak for Paul here. So what we do in California is at the end of each review, we compile all our errors. So what we do is at the end of our database, it flags each discrepancy any kind of things that didn't match. And so at the end of our whole fiscal year or travel season, it gives us a complete list of all errors that were found. And that's pretty much how we're doing our cross-checking.
And with that data, are you have follow-up trainings or other resources developed to, yeah, go ahead.
We do training technical assistance. We do error rate reduction plans in which we give timelines, and we work with agencies to reduce those findings.
Perfect. Give it just a second, see if anyone else has anything they would like to share. Oh, Jim in New York. Thanks, Jim. You can go ahead.
Okay, good afternoon. So we do some data mining and run some regular reports for several different reasons. One kind of relatively new initiative we've been working on the past couple of years is that we run reports from our licensing database and identify providers that list themselves as providing child care services during what we call non-traditional hours of care, which would be evenings and weekends. We then take a sample and we go out, and we've been doing monitoring visits during evenings and on Saturdays, and we do those a couple times a year. And then we further that by taking a look at any of the attendance and claims data that's being submitted and claimed against. So we can see if during our inspection whether there was children there, and then also take a look at the data to see whether a provider has or hasn't submitted subsidy claims for those children. So obviously an area of concern would be that we go to programs, there's no children there, and then we review the subsidy claims and we see that claims were submitted at the same time that we had done those inspections. So that's really an internal control piece that we've focused on using data mining over the past couple of years.
Thanks for that, Jim. My question that I think of right away is, did you have to advocate pretty hard to get resources for evening and weekend work? Send staff out?
We did it on a voluntary basis, and staff have been willingly, volunteering. And of course, we've made some schedule adjustments in their work schedule to accommodate that. I think we started it small, and we kind of scaled it up every time we did it. It's grown bigger and bigger. And we really got buy-in, and an interested investment from all of our staff because they wanted to see what's going on in their programs outside of the normal hours that they would usually be inspecting.
Sure. Great. Thank you. I see one more hand raised, so we're going to go ahead and Jackie Bensel from Delaware, she's on, and it looks like she's willing to share. And then I think this will be the last one, and then we'll move on, but we can certainly come back to this topic at the end if there's time.
Hi, can you hear me?
Yep, I can hear you. Go ahead, Jackie.
Great. Some of the things that we do is in our field offices, when you refer to the policies and eligibility rules, is that we have our field supervisors who do what we call supervisory review instruments, and they will review the cases prior to the confirmation to make sure that it's matching up to policy, to prevent areas in that and to prevent the errors in that area. And then we also have internal reports that we work out of where our child care monitors actually will pull the reports and they'll look at our sites that have 10 plus children and make sure that they are actually licensed to have that many children. And then if not, then they will go do site visits and they'll compare their attendance sheets and do a site visit with them.
Perfect. I hear a lot on the provider side. I think that's telling, as we hear a lot of the potential fraud happens on the provider side of the house, or at least the majority of it. All right. Thank you, Jackie, for sharing, and everybody else. Yay! I love when we have participation. All right. So we're going to turn it back to Janae, and she's going to get into data sharing.
Awesome. Thanks, Leanne. So yeah, that was a lot of good takeaways for for data mining from Louisiana, California, New York, and Delaware. So let's get into data sharing. What is data sharing? In terms of eligibility, many see data sharing as the nuts and bolts of program integrity in government programs. Now, data sharing may incorporate the collaboration of federal and state programs through database linkage, or provide agencies the ability to view other agencies or organizations' data. In data sharing, the lead agencies have the ability, when they're viewing this information, electronically, of course, to assist them in making decisions prior to certifying applications or making eligibility decisions on applications. Data sharing could be viewed is viewed as the preventative and or detective element in internal controls. And let's talk about some of the sources in data sharing. So the first thing we have here is TANF, SNAP, and Medicaid. So for those who are not so lucky to have TANF, SNAP, or child care under one agency, this would be a good source to start with data sharing. It would come to be a very useful tool when sharing information or receiving information from those agencies that administer these particular subsidy benefits. Next, we have PARIS, the Public Assistance Reporting and Information System. Now, for those of you who are unfamiliar with PARIS, PARIS is an information exchange system that provides state and federal matching data for public assistance programs like TANF, SNAP, Medicaid, child care, and workers' comp. PARIS was designed by ACF, and it's a free data sharing option. So if you are a lead agency that is interested in data sharing with PARIS or receiving that information, you're to reach out to your state representative for PARIS. And if you are unsure of who that person is, definitely get with myself or Leanne after the webinar, and we'll be happy to point you into the right direction. The other ones that are listed here as possible data sharing options include SSA, which is Social Security Administration, Child Support Enforcement, Vital Statistics, and non-public organizations or agencies. Now let's talk about those for a second. In reviewing the recent ACF 404 reports or the improper payment reports, we see a lot of states referencing the work number as means of verification for income. This is also a means of data sharing. Remember, data sharing in government subsidy programs is ultimately about communicating information and or receiving information related to individuals requesting assistance. You want to confirm as a lead agency through your internal controls that the information provided by the applicant is accurate and a true representation of the individual's current circumstances. This protects the integrity of the program by ensuring the funding is going to actual eligible recipients. Now let's move and see how many individuals or state lead agencies are actually using some form of data sharing.
Thanks, Janae. Yep, so very similar to data mining, 73% approximately of our lead agencies are utilizing data sharing as an activity to fight fraud and ensure program integrity. And we already have an example coming in. Hopefully you all can see it in the question box. But Allison Wilson from Texas indicated that Texas matches child care data with unemployment insurance data to flag cases where a parent may no longer be working or whose income might exceed 85%. So again, data sharing or data matching with unemployment insurance is a great example of one of those strategies. So let's go ahead and launch another poll. Make sure everybody's still awake. And if you could please respond to this one, if I could see it. Does your state currently participate in data sharing with other programs? So possible responses are yes, no, unsure, or maybe it's something that you're thinking about. You've been collaborating and communicating with other agencies and you're, getting started in the process, maybe getting an MOU or MOA in place in order to start data sharing. And by MOU, just in case there's newer folks out there, Memorandum of Understanding. So it looks like you guys are quick on this one. About 52%, 53% have voted. Oh, good. I like to see, oh, you guys can't see this yet. I'll pause. I'm getting ahead of myself. All right, it looks like it has slowed down with the polling. So I will share the results for everybody. So wow, it looks like a lot of you are already doing some type of data sharing. 10% maybe are newer to the program, not quite sure, but definitely can look into it. But we have 2 of you with MOUs or MOAs in process. Just a real quick show of hands. Do you mind raising your hand if that's you that's in process? I won't call on you. Just curious. We have some resources that might be able to help you. Oh, I don't see any hands. All right, no problem. You can feel free to reach out, or we'll talk about MOUs and MOAs a little bit later. So hopefully there are some of you who may want to share a little bit about your data sharing strategies. If there's anything maybe unique or new that you're doing and you want to share with your peers across the other states, feel free to raise your hand, and we'd love to hear from you. Oh, Jackie, thank you. Jackie from Delaware. Do you want to go ahead?
Hi. Okay. As we were talking, I remembered one that we also work with on a provider side. There's several that we work with, and we've actually incorporated some new ones. One is that we work with the IRS. So sometimes our providers, they might, when they file their taxes, it might not correspond with what they've reported to us when under their license. So we'll get an alert to say from the IRS that's saying this isn't correct, they aren't matching. So then we will have to go in and, you know, we touch base with the provider. We need to find out why they're not filing under the same EIN. So that's one data match that we can find and see what's happening in those cases on why they would be filing under a different number. We also recently, CMS works what we call, in our eligibility system, we have the federal hub. So when we put in a social security number, and this was more for the Fed side or the FNS side of it, when we put in the social security number, it would match to see if they are a citizen, so it would identify them if they have established their citizenship and identity according to the Medicaid rules. So we are permitted to use that also if need be for the child care program as we're running individuals. And sometimes it actually is good for us because then it will say to us, the social security number is not matching the individual that you put in, and it'd kick it back to us. And it could just be that it was just a slight typo, and then we could just go and adjust that. So that's another data match that we use. We also have the EDRS system that lets us know if a recipient has been disqualified in another state. And of course, a lot of the systems that you had already mentioned. We also work with, we have data matches with the Department of Motor V, child support, and then our death master file is a new one that we just currently put in place, and that will alert us when individuals have passed away that have been recipients of our programs.
Thank you, Jackie. That, I wrote a note here, the federal hub, that one was new to me. So I'm guessing, you know, this data matching, data sharing can take on a lot of different forms, and sources might be, you know, seemingly unlimited, but certainly those eligibility systems that house child care, in addition to TANF, SNAP, Medicaid, I'm sure there's a lot more options for data sharing as soon as you throw SNAP in there, because you can link to things like this federal hub.
Absolutely.
Yep. All right. Anyone have any questions for Jackie? If so, you can either type it into the question panel, question box, or you can raise your hand and we'll unmute you. All right, I'm not seeing anything come in, but I see Louisiana, Melinda and team, you have your hand raised. Would you like to share with this one?
Sure. Louisiana utilizes a lot of data sharing entities. We heard you mention Paris, and that is currently in the works for us, and we are excited about that. But a couple of other entities that we utilize is LINKS, which is connected through the Department of Health and Hospitals for us to check immunization records. We also utilize a secure network with the Department of Children and Family Services to get any verification documentation that we may need between cross agencies. We also utilize Work Number, which is what we utilize to verify employment with the Louisiana Workforce Commission. And then we also do some verification and case processing information when it comes to our funding with the Department of Revenue, with the Office of Debt Recovery. And that's pretty much it that we have for now, but we are constantly growing here in Louisiana, and we look forward to any feedback that you may have, and we already heard some good suggestions from other states that we may try to implement on our end.
Awesome. That's exactly what these webinars are for. I think it's so important to the communication, collaboration across programs, across offices, just within your state to try to learn from one another and maybe tap into some other types of data sharing that maybe other programs are utilizing. Would anyone else like to share, or anyone have follow-up or feedback for Delaware or Louisiana? Maybe anyone who has recently gained a new data sharing partner, such as Paris. Any tips or lessons learned for Louisiana? I don't see any new hands raised or any new questions have come in to the question box. So we'll go ahead and move on. Oh, I hear or I see something from Shelley Dilks. How about the Child and Adult Care Food Program? There's lots of states that will link into that provider resource in order to see if there are states that, providers that are no longer eligible for the food program, or also comparing of attendance invoices. What's a provider submitting to CFP versus what are they submitting to the lead agency or the program office? Would anyone like to talk through those experiences? Or maybe I just shared enough.
We utilize the Child and Adult Care Food Program as one of our collaborations. We have a unique situation in that we're in the same building, and so we're able to get compliance reports so that we can look at we look whenever a provider is struggling in another department. We check to make sure that either there's something that we can do as far as TNTA for our department, but also it gives us a red flag that there may be a problem, as you said, with the attendance records and other things that they may be struggling with the food and nutrition program. But we are in the same building, so we constantly monitor and get information back and forth.
Great. Does that also include a report of disqualified providers from the food program?
Yes,
yeah.
It does.
Okay.
Yes, it does. Yes,
Thank you. I'll pause just for a second here, see if there's any other questions or comments anyone else would like to share related to data sharing. And if not, I see Eric from Vermont. Eric says, Eric does not have a mic available. Sorry about that, Eric. but Vermont does occasionally compare attendance info with the Child and Adult Care Food Program on a case-by-case basis. No formal reports are shared, just comparing notes and claims on clients of mutual concern. But up in Vermont, small enough where they can have those individual conversations. Great, Eric. Thank you so much. Yep, again, the communication and collaboration is so important, even just, whether it's walking down the hall or picking up the phone. Jim in New York, go ahead.
Yes, I just wanted to add that we've been in conversation with our State Department of Health, who administers the Child and Adult Care Food Program, and we ultimately will be looking to do some data sharing with them. There's a couple little challenges because we want to be able to import that data into our analytical tool that we have, and it's in a little bit of a different format than our existing and current data sources. So I didn't chime in when you were talking about the MOU or MOAs because we don't have anything formal established, but we have been in conversation and are moving to work to start importing that data into our analytical tool.
Great. Thanks for that. And hopefully when we get to the data analytics piece, Jim, you can maybe give us a little bit more info on your data analytics tool. I know we presented on that last summer, but you're one of the few states that really has, at least that we've seen, a solid data analytics tool. And to integrate and add more to it, awesome.
Sure.
All right, so we are going to go ahead. Oh, I see one more question that just came in. Thank you, Katie. In Montana, the Child and Adult Care Food Program, Child Care Licensing, and CCDF meet on a regular basis to share data and be sure we are communicating about programs that may need extra support. Thank you so much, Leslie, in Montana. Great. All right, we are going to go ahead and move on to our next topic, data analytics. Back to Janae.
Awesome. Thanks, Leanne. So let's talk about data analytics. We touched on it just a wee bit just now. So if we try and keep it simple, data analytics is looking at what your program, the data your program possesses, and assessing what you can pull from that data. Data analysis can identify abnormalities, trends, or risk indicators within large data sets. For example, if a lead agency wanted to conduct a review on additional staffing, for instance, data analysis could assist the lead agency in understanding possible staffing needs. So it can do more, data analytics can do more than just fraud and administrative errors and things of that nature. The analysis in this scenario could review information from the daily volume of applications that the lead agency receives, look at the staff processing times, and the results could indicate when and whether or not additional staff is needed during a certain fiscal time period. For instance, March of every year, the lead agency gets a slew of applications, and based on the processing time, they're not able to meet the procedure outlines that are set for processing applications or redeterminations, let's say in 30 days. So data analytics could prepare you for future staffing needs. In addition, the program and data can analyze information based on a set of potential fraud indicators or red flags. In previous webinars and earlier, states have shared examples of red flag reports, and some was mentioned in the data mining. It is important to note that these types of reports used for data mining and detecting patterns within both current and historical data can identify what we call as outliers. Those are those atypical results when compared to the expectations of the program based on the procedures and policies. Data analysis tools can be as simply as running those reports as we discussed, or as sophisticated as the use of an executive dashboard. So let's talk about the executive dashboard. The executive dashboard can provide high-level program information. Generally, the executive dashboard will be supplied with daily updates, such as the total number of children served by age or provider type, the total number of providers by each type, total number of children on a wait list if you're in that situation, or the amounts of children being served across the program, etc. So it can meet whatever needs from an executive level that the administrator would like to monitor on an ongoing daily basis. This information could also provide new information on current fiscal or future expenditures or budgeting, which leads to predictive analysis. I know that New York is going to share with us some of their predictive analytical tools, so I won't get into that too much, but I would like to say that there may be other states that also use predictive analysis, and we would love to have you guys show your demo on one of our future webinars. But needless to say, there are different types of data analysis, and all of them support good work or practices by providing data-driven insights about the program. And that data can be historical, which means that the data analytics is analyzing information from the agency's past data to make predictions on possible outcomes. It could look at new information, application authorizations, and/or payment monitoring. It can look at internal or external sources, surveys from applicants or providers, market rate data, licensing, eligibility, SNAP, provider or policy research centers. You see, data information with data analytics can be used across the program. And again, it doesn't necessarily have to focus in on fraud or administrative errors or program violations as it relates to program integrity. So what I'd like to do at this time is get a quick raise of hands of individuals that use data analytics outside of fraud or program violations or administrative errors. So let's see what we come up with. So raise your hand if you utilize, there we go, hands are going up already. Well, 2 hands.
Yeah, I think this is a great question, a good way to kind of break it up a little bit. So again, if you're using data analytics for other things other than just program integrity work, so right at the start of the call, Ellen mentioned using data to help inform decisions, maybe to request additional funds or get some regulations changed in your state. So just a quick show of hands, how many of you are using data analytics for things, you know, outside of program integrity, but maybe, again, more to kind of inform decisions? Just all we're asking is to raise your hand so we can kind of get an idea.
Yeah, we won't call on you this time.
No, we won't call on you. Don't be afraid.
Awesome. All right, perfect. So we just wanted to kind of get a count of those individuals. Let's go right into how data analytics work. So data analytics can perform functions that are set automatically through programming logic and may be based on your program's procedures, policies, and desired outcomes from the analysis. So, for example, if I needed an estimated number of summer care funding for appropriations or budgeting, data analysis would assist me with providing me a report on historical fiscal expenditures for summer care. I could look at the current part-time children, past part-time children. I could pretty much incorporate any variable I wish to get the desired outcome from the data analysis. And let's talk about the type of data, the information. So you have the verification information, such as the income of a household, household composition, children age, priority level, things of that nature. You may want to know the percentage of children served in a specific priority level for future budgeting. Excuse me. Provider and participant data compared. Is there a need to raise a payment rate for an area to balance the cost of travel for families? Or should the lead agency be looking at ways to bring lower quality providers in a specific area based on an analysis, of course, to higher quality standards. You have a lot of families that are in a specific area, but they're traveling, long ways, 25 miles out, 10 miles out, 15 miles out to go to high quality providers, but they have providers in their area that are closer, but they're not as, the quality of the provider does not meet the needs that the family wants. So how can we fill that gap? Looking at a cost-benefit analysis or a cost-effective analysis on helping the providers and families. So that's another way analysis can aid in the review of policy and alternate policies or procedures. In addition, there's the payment data or fiscal data that you could look at for an analysis. And last but not least, there's the risk areas for potential fraud and errors. So here it's identifying those errors for potential fraud, administrative errors, to take those proactive measures to close gaps through retraining, and again, those alternative policies and procedures. So let's take a quick look at a quick overview of data analytics. So data analytics can assist you by providing predictive analysis on process outcomes. It may employ artificial intelligence that requires less input by the IT team as the system learns the process of the program and provides that reliable data for use. Or it can incorporate statistical data that may provide those emerging trends of fraud in specific areas of the state or the agency and give those outliners that we previously discussed to allow the agency to put in those proactive measures. Data analytics can be seen as a predictive element when looking at the data for internal controls. On our recent research of data analytics, we saw that less than 15% of lead agencies perform data analytics within the child care program. So let's talk about that. Leanne?
Thank you. Yep, back to me on this one. So again, our research, where we got this information from was, most of it was from the state plans, again, either the 16-18 submittal or the draft unapproved 2019-21 state plans. The other area that we pulled information from was state websites or, other research online. And this figure was actually a lot lower. It was closer to 7%. But as we were doing our research, we found that there are quite a few counties out there, county-administered, state-supervised, county-administered states, where the county is performing some type of data analytics within the CCDF. And, 9 out of 10 times that county is providing services for TANF, SNAP, Medicaid, and child care. And again, the county is running some kind of data analytics within their system, but that may not be occurring at the program office level. So that number might be a little inflated at 15%. So you can see, with a smaller number here on this one, we did want to spend more time on data analytics. And Janae did a great job sharing just some of our research in this area. It's a huge topic. For those of you who may work in the SNAP program or have colleagues that you talk to frequently in the SNAP program, they're doing lots of data analytics on their side of the house. But again, it's an area where we hear more and more from states kind of having this thirst for more knowledge around how data analytics can be used within CCDF. So we're going to open it up for conversation again. I know Jim is ready to share some of New York's strategies and what they've been doing with data analytics. But before we get to that, let's launch another poll. If we could, please just take a moment and use the poll to provide us with your experience with data analytics. So are you currently using data analytics and really you're loving the results and maybe our figure is a little low? Are you using data analytics, but maybe you want to do more with it? There's more available, you're digging into, some other resources that might be available for data analytics. Or the third option there, data analytics is out there. Maybe it is used in other programs within your state or department, but you're just not using true data analytics in childcare yet. And again, data analytics takes on a lot of different definitions, a lot of different forms, and just know that. It's okay if we're not all 100% on the same page when it comes to this, but we know that most all of you are using some form of data mining, and that can bleed into data analytics and really trying to predict behavior and get strategies and get ahead of some things out there. So I will go ahead. Actually, only 32% have voted, so I'll give it another couple seconds. See if we can get the response rate up around 50% as we've had for our other polls. I hope we didn't lose anyone. Oh, here we go. Some more folks are voting now. All right, I'll go ahead and close the poll. Oh, I see people are still voting. One more second. Get your votes in. Okay, I'm going to go ahead and close it. I'll share so everyone can see the results. So our numbers may be a little low on our webinar research and what we were able to pull from the existing data out there, but 21% of the states on the phone today are using data analytics and loving the results. So that's awesome. I'd love to hear who you are and try to get some more conversation going there. 61% are using data analytics but want to do more. So great. And I know this one you could only choose one. So perfect. Our numbers are much higher than we anticipated. So I'd love to hear more from you guys. 18% data analytics is used in other programs but not in childcare. So great. I can't wait to get into this discussion to hear from you all. Jim, I'll go ahead and turn it over to you because I know you had wanted to share more on New York strategies and your current data analytics and fraud investigation tool.
Okay. So yeah, just about 2 years ago, we implemented a technical solution, which we call CCPI, Child Care Program Integrity, and it's a tool that was designed to support subsidy fraud investigations. We are a county-administered child care subsidy program, so state-supervised county-administered program, and we cut across 58 different social service districts that administer the program. So we were really trying to get a tool out there for the county workers to use, whether it's their child care staff or their dedicated fraud investigators, to really give them a starting point and also provide background data to support their child care subsidy fraud investigations. So we had a vendor-designed technical solution, again, that we rolled out just about 2 years ago, and we're still really in the, I think, deployment phase and implementation phase, and we're really trying to strengthen use and, make some fine-tuning in the system and work out some bugs and also identified some training needs. And really, we've been working to support the county social service districts in use of this system. But conceptually, it was designed to take data from 4 primary child care data systems and integrate that data and then evaluate the data against what we have to come up with of 20 different what we would consider indicators or red flags. And I know that term gets used a lot in this space. So we took data from our child care time and attendance system, from our eligibility system, from our payment system, and from our provider system, our licensing database. And one of the challenges, I think, is that the data historically has been housed in silos. And one of the things that CCPI has been able to do for us is bring all that data together in one place, and we can see that information on one screen, but it's data that reflects the data from those 4 different systems. So it's helped to simplify the evaluation of data and the viewing of that data. It basically takes the data from those systems and it runs it against what we have come up with as 20 initial core indicators. We designed the system with flexibility in mind because we know that what we thought of was an indicator 5 years ago may not be the same in the future. So we wanted to make the system flexible enough that as long as we have the data and we could pull indicators from the data, that the system should be able to evaluate that. And we also wanted to design it to be able to accommodate different data sources in the future as well. As different data sharing agreements maybe get secured or different data becomes available, we didn't want to limit ourselves to our, our 4 standing childcare systems if there's other data available. So those were some initial considerations when we designed it. Do your research is something that I highly recommend. We spoke with a couple other states who had done some work in the data analytics realm, and it was very helpful feedback that we got. And some of it was a little bit more limited and not going, fully into developing a standalone technical solution. And some of those other states partnered with companies and vendors that actually did some of the analytical work for the state themselves. So we learned a lot, and there's a lot of research out there regarding predictive analytics and data mining. Our technical solution is really designed to do both. It mines the data, and then it does predictive analysis with that data. Some recommendations that I have if people are going to pursue some data analytic tools or developing a data analytic tool is really to get input from your stakeholders, especially during the design phase. At least in New York, every county has a little bit of a different business practice and different business process. And I think it was important, and not that we heard from every single county, but we heard from a lot of them, and we also got input from some of the counties when we came up with our initial list of indicators. The predictive analytic models, I think, are very helpful because once they see a certain pattern in data, it will continue to flag that data going forward. So if we think that was an important model to adapt in our state. I think overall it's been going well. Again, we've been really working to support the counties and getting them on board with using the system on a regular and routine basis. Our model runs every month, and it looks back at 6 months worth of data. So every month it runs, it looks back 6 months. And that's really to give that historical trend data and allow the system to be able to pick up on different patterns that it may see in the data. We designed it as a tool, so it is not initially mandated for use. But we know that when technical solutions roll out, there can be challenges. So we wanted to get it out, get people trained, get them on board, and really designed it as a tool. I think one of the challenges that we've seen is that we have 57 social service districts currently that have access to CCPI, and each one has its own individual business processes and practices, and we're really working to support the use in each one of our districts. So I think that's one thing that has been a little challenging, and we've been working to provide on-site technical assistance to get each county on board if they request that from us. So I think that's some of the highlights of kind of an overview. I don't know how much detail you wanted me to go into.
No, I think that's great. One of the first things that you mentioned was in your data analytics tool, you're pulling from 4 different programs. Can you tell us what those 4 programs are?
Sure. So we're pulling from our 4 primary, what I would say, child care data systems that we have in the state. So we have our CCTA, which is our child care time and attendance system. We have WMS, which is the state's welfare management system, which has eligibility data in it. We have our BIC system, which is our benefits issuance and control system, which has payment data. And then the last one that we're looking at is our child care facility system, which is our statewide system of record of all of our child care programs.
Awesome, thank you.
And it aggregates that data in the technical solution, and then it evaluates it against our 20 indicators of potential fraud.
Right. And I think it's good to hear, too, that your system can learn from itself and is flexible in that you can change those 20 indicators down the road if you choose.
Yeah, I mean, one of the things that we were concerned about going into it is if we keep getting, the same indicator keeps coming up, but it's really not leading to substantiated cases of fraud, well, we may want to remove that indicator. All of the indicators have different weightings on them, and so we could adjust the weightings if need be, or potentially remove an indicator altogether if we don't find that it's providing accurate information to us or helpful information to us.
Right. And then you can also prioritize those cases, to prioritize what cases investigators are going to go out and take a closer look at, correct?
Yes, that's correct.
And the system does that for you.
Yes, it does, and thanks for mentioning that. Yeah, so when we designed it, one of our requirements was that the system had to give a ranked report, basically. So each county can log in on a monthly basis and see the report for their county, for their district, and it's ranked based on the level of risk identified in the analysis. So the investigators could focus on the ones that, the ranking scores are from 0 to 100, 100 being the greatest probability, so they can focus themselves on the highest ranked cases and really focus their energies there and look at the data. And one of the things that it also provides is the ability to drill down into the data. So you can go in and see which children were in attendance on specific days and the times that they were there, all in that one system.
I'm almost speechless. It's just amazing how all the data can come together, be mined, just like you said, and then analyzed. And I'm picturing, hopefully other folks on the phone remember when Jim presented for us last summer on the Program Integrity webinar, he demoed that tool for us. So I'm picturing it, and just, I don't know, everything that's behind the scenes that's occurring, it's fascinating to me. I don't know. Sometimes I wish I was back in state government and I could see all this stuff in action. We have a question for you, Jim. Do you mind giving some examples of those fraud indicators? Maybe like what are the higher ranking ones that, cause the investigators to take a closer look?
Sure. So, we look at, again, we have to look at indicators that reflect the data that we have in our systems and have access to. So we looked at if attendance is exceeding what the license capacity of a program is. Or we look at children that have perfect attendance and are never absent. Mm-hmm. Or we look at children that have precise attendance, meaning that they sign in and sign out, they're signed in and out of the program at the same times every day, or similar times, a little variation. One of the things that we look at, which is we've gotten a lot of really positive feedback on, is we do an analysis of the distance between the provider's location, the child's home, and the parent's place of employment, and we triangulate that. And that's really, if that indicator comes back, that's usually one that people like to look at a little bit more closely. Again, none of these in and of themselves mean that there's fraud occurring, but if you have multiple indicators coming up, and that leads to the higher ranking, those are the cases that we would expect people to look at a little bit more closely.
Sure. Does anyone have any questions for Jim? Or does anyone else on the line have data analytics, the software or the strategies that they're using that they would like to share? This is one of the few times where I'm happy that I'm wrong in that, our research turned up about 15% of lead agencies performing data analytics, but based on the polling, it looks like there's a lot more out there that are using some form of data analytics. So very happy to see that. And again, I may be reaching out to some of you to learn more about what's happening in your programs. Okay. But if anyone else would like to share, please feel free to raise your hand or type in the questions box.
Raise your hand right here.
Oh, let's see. I see a question that came in. Jim, this one's for you. Maybe this attendee also doesn't have audio, but are all programs able to have access to data across all programs? I'm not sure if I understand that question.
Well, if they're asked, maybe the question is, do all the counties have access to each other's data? And the answer to that would be no. The data reports that get generated on a monthly basis are specific. The counties can only see the reports for their counties. I'm not sure if that was the question.
You nailed it. Yes, Diana typed in the question box again. Yes, that's exactly what she was looking for. Thank you.
Now, at the state level, though, we do have the ability to look more broadly across the different counties. But at the county level, due to confidentiality concerns and security concerns, the data that's available to them is specific to their county. There is a flag, though, is if their case has been flagged by another county, there is a flag indicator that shows that this case has been, flagged, because we do know that some of these cases cross over between different jurisdictions. And there is an indicator to reflect that in the system, but there's no specific data that one county can see involving another. I think the assumption would be that there would be, probably a phone call to that corresponding county to, have a discussion about what their potential concerns are with that individual.
Excuse me. Yeah, that makes sense. And just for everyone else on the phone, I know Jim mentioned it, but New York is a state supervised, county administered state. So, they may have some more protocols in place per se to, I don't want to say prevent, but to keep things that are in the county within the county. Am I saying that right, Jim?
Yes, that's correct.
All right, I see that we are getting short on time here, and we only have a couple more slides to go, but I'm going to go ahead and get us back to the content in the slides, but hopefully at the end we'll have time again for more sharing. I think I see a couple more hands raised, so maybe there are some other states that want to share data analytics, but we're going to go ahead and move forward. And again, I think we'll have time at the end for a little more sharing. If I can get my slides advanced here. All right, so Jim did mention some challenges as he was talking, but with any of these new processes, there certainly might be challenges when implementing. And data mining, sharing, analytics, they're probably going to see some of the same challenges that you all see when implementing other program changes. And we have just a few mentioned here for consideration. The first one is quality. So data is only going to be as good as what's inputted into the system. So whether we're talking about, client data being entered at the time of application, provider information being entered, or the information that's transferred from your eligibility systems into something like a data warehouse. So tweaks may need to be made along the way to ensure that data is both inputted accurately and logically into your systems. The second one is data volume. There may be significant data volume. CCDF programs alone are serving thousands to tens of thousands of children, just children, per month. So then if we combine the child care case level data with programs like SNAP or TANF that are serving hundreds of thousands of participants each month, now we're looking at a whole lot of data, or what some folks out there call big data. So any data analytics infrastructure really needs to be able to support these large volumes of data. Then if we think about kind of the output side, there really is a potential to produce so many reports with all this data that it could become difficult to review and manage. So it's important to ensure that there's processes in place to manage your data, and certainly you'll want to engage your state experts so that both useful and effective reports can be developed. The third bullet, PII or personally identifiable information. So we need to ensure that there's appropriate security protocols in place to protect confidentiality as well as the integrity of the data. The last point that we added here for this one for consideration is cost. So certainly some of the more sophisticated data analytics tools, they can come with a pretty steep price tag. So you'll need to think about if your program has resources to implement one of the more technologically advanced tools. But I do want to share that many states that use these more comprehensive reporting and data strategies, they do believe that the results are worth the investment. And I know I've heard this in talking to some of you just very recently about data analytics. So when using data reports to prevent or identify fraud early, they might be far more effective in some situations than waiting maybe for an investigation to be triggered by a call into your fraud hotline. So again, kind of more reactive, keeping it proactive instead of reactive. Just also want to point out, lastly on this one, CCDF funds can be used to support internal controls and program integrity, including those data mining and data analytics tools. All right, so we talked through the challenges. Now let's get to the benefits. So our first bullet here, these data options allow agencies to review and evaluate large data sets. Again, like I mentioned before, potentially from several different sources, especially if your child care program is connected. Again, TANF, SNAP, Medicaid. I think we've said that a couple different times now. But reviewing and analyzing the data can definitely improve efficiency by boosting performance. And we've heard that from some of you just today sharing your strategies. Analyzing the data also gives you the ability to take proactive measures to reduce errors by identifying those early warning signs. For this one, I like to think about time and attendance invoices and comparing those to provider capacity reports. And I think that was one that's already been mentioned on this call. So data reporting has the potential to stop improper payments before they occur. Also, data mining can identify those areas that you may need to take a little closer look at within your program, maybe provide more training to staff, or once potential cases of fraud are identified, prioritize staffing efforts to investigate or maybe if appropriate, recoup improper payments that are a result of fraud or a result of other program violations per your agency's policies. And most importantly, when we talk about data mining and data analytics, again, something that was already mentioned is that it's not a one-size-fits-all makeup, that these options can be customized, they can be made flexible, and kind of designed to meet your program's needs. I also want to mention, and we mentioned this already, I think, a couple times, but I want to reiterate it, that data isn't necessarily just for internal controls, but it can also be used to help the state administrators, to help state leadership when pushing for things like new legislation or additional funds for the program. So again, I know we've said that before, but I just want to reiterate that data can be used for lots of different benefits to your program. All right, I threw this slide in there, mostly for all of you, as just an opportunity. If you would like to share your state's vendor or company that you use, an opportunity for you all, again, to share with one another. As a national center, we certainly are not in a position to endorse or encourage any particular vendors out there. But again, I wanted to throw it out as an opportunity for you all to share maybe any experiences, or again, the company, the vendor that you've used for data analytics or data mining, if it's outside of your program office. I guess that's enough. If anyone would like to share anything regarding their vendors, again, feel free to raise your hand, or you can type something into the questions box, or we can also just keep moving forward. I see a couple hands raised. Daisy in Louisiana, would you like to share? Or Melinda, the Louisiana team? That might be a leftover hand raised. Jim, I see your hand is raised also. Did you want to share a little bit about your vendor in New York?
Hand raises were left from the previous questions.
Okay, thanks, Melinda.
Yeah, I think they were left from the previous questions.
I see one of our states has typed in Mathematica into the questions box as a way to share. Would anyone else like to share? We can keep on moving. All right. I'm not seeing anything else getting typed in or seeing any hands raised. So we are going to keep on moving along. And this looks like a perfect segue because actually I see a question that has come in from Diana. West Virginia is currently developing a tool that covers multiple programs, and they too are having issues with confidentiality. So that is actually my next slide. Confidentiality, of course, it's of extreme importance when a lead agency sets out to utilize these data options and really all functions within CCDF administration. So although there aren't specific procedures outlined within the CCDF regs, lead agencies must have in effect policies to govern the use and disclosure of confidential and personally identifiable information about the children and families receiving CCDF assistance, as well as the child care providers receiving CCDF funds. So that statement may be familiar to a lot of you on the phone. It was one of the elements in the 2019-21 state plan preprint. So lead agencies were asked to describe these policies, and I'm honestly very excited to see, what their responses are out there once the state plans are approved. Also, for confidentiality, the Federal Privacy Act of 1974, it generally applies to federal agencies, but just to note that there are guidelines that include information on data matching for non-federal programs. So something that you may want to take a look at. And also, final note, lead agencies should always consult a member of your legal team and/or your program administrators to review the laws that govern your state and your state agency. All right. I think this might be, we're approaching the end with 3 minutes to go. Written agreements. So when developing processes for sharing information across programs or departments, it's usually going to lead to a written Memorandum of Understanding or MOU. And that's going to include the details of what information will be shared, when, with whom, how the information will be shared, and then once shared, how it will be maintained in a confidential manner. So we do have some other points here about what you might see within a Memorandum of Understanding or Memorandum of Agreement. And we are drafting a sample MOU at the Subsidy Center. We've heard from a couple of you that it would have been really helpful as you were attempting to draft language for an MOU, to have a sample or an example to look at. So again, we do have something in the works for that. And if you would like to get your hands on that sample MOU, while you're consulting, of course, with your legal partners and others within your office, we're happy to share. You can include a note in the evaluation that will pop up at the end of the webinar. Reach out to your regional office or, of course, your regional subsidy center liaison. All right, and we're back with 2 minutes to spare for questions and open discussion. Boy, I got to say, I'm glad I scheduled for 90 minutes. I was only going to do this one for an hour, but I'm so thankful to all of you for participating today. Thank you, thank you, thank you. Any last-minute questions? Anyone else wish to share before we wrap it up? I'm not seeing any hands raised or new questions coming in. And I think we're starting to lose people. So we'll go ahead and wrap it up. Again, thank you everyone for your participation today. I'm really excited to continue these webinars, continue these discussions, hear more about what all you guys are doing out there in the field. Of course, at the end of the webinar, as always, there will be an evaluation that pops up. We'd like to get your feedback. We want to hear about your program integrity efforts and certainly how we can make these webinars more beneficial to you by providing the content that you all need. So please feel free to complete that evaluation. Our next webinar is March 12th, and I hope to see you all back then. So thank you again. Thank you for participating and sharing all of your knowledge with us today as well. Thank you.
Thank you.